Dr. Ronald Innerfield is GRMC's endocrinologist, a specialist in the causes and treatments of diabetes and other diseases. Recently, a patient was referred to him who had significant low blood sugar levels.
When I see an individual who has significant low blood sugars, I have a specific protocol in mind, and I ordered that protocol. Fortunately, I have good people around who conveyed my orders to the laboratory. The laboratory did things appropriately. We did what's called a glucose tolerance test, a 5-hour glucose tolerance test, and lo and behold, her sugars fell significantly, which is what we usually see in something called reactive hypoglycemia. And associated with that were very high insulin levels. And my first take was that this was reactive hypoglycemia associated with insulin resistance.
But it wasn't.
It was not, no. It was something a lot more rare.
It was a disease known as Insulinoma, says Dr. Innerfield.
Incredibly enough, it turned out that it was really a tumor that makes too much insulin. It's called insulinoma. It's a neuroendocrine tumor. It arises in the insulin-producing cells in the pancreas, the beta cells, and they make too much insulin. The way I found that out was I put the patient on a very low carbohydrate diet, which usually works in reactive hypoglycemia. It should stop the process of sugar falling low. I thought it might be insulin resistance because we see tremendous amounts of insulin resistance on these islands. But in point of fact, since the next day, when I put her on this low carbohydrate diet, she still had more severe reactions. And that's not typical of reactive hypoglycemia. This is a situation where in an individual practitioner's experience, you may see one of these every 250,000 patient years.
That rare? That rare,
yeah. So if you see 2,000 patients a year in an average practice, it'll take you 125 years before you see one of these kinds of patients. This was a very, very rare presentation of a very rare disease.
And it sounds very serious.
It's serious. Fortunately, there's medication that we could put her on to keep her from getting her sugars too low. It's a malignancy, but as malignancies go, particularly pancreatic malignancies, it's pretty benign.
The prognosis?
The prognosis, as I say, is very good. She had these symptoms going back for a whole year before. She came to me October 15th. It's now, November 3rd. We were able to confirm the diagnosis of an insulinoma probably within a week and a half. By giving her at least some medications to control her blood sugars, and by pointing her in the right direction, getting reasonably expedient surgery, she should do great.